Hello, welcome to Physician Spotlight. I am your host, Dr. Jay Patel. Physician Spotlight is a forum to learn more about our outstanding physicians in the field of nutrition and discuss important topics and ideas. With the help of ASPEN, we are bringing these videos to you. Our guest today is Dr. Christian Stoppe. Dr. Stoppe is an associate professor of anesthesiology at the University of Würzburg in Würzburg, Germany. He is a gifted researcher and consider him an expert in micronutrients as a form of therapy in critically ill patients. I'm excited to have Dr. Stoppe with us here today. Dr. Stoppe, thanks for joining us.
Well, thank you. It's a pleasure to be here. Thank you.
Dr. Stoppe, one of the questions that always gets asked on these videos is, how did you get started in clinical nutrition?
So, yeah, basically one of the key moments in my life of research was when I was meeting Daren Heyland on the International Congress of Intensive Care Medicine in Brussels. And actually, he reached out to me and asked me if I would be interested to have dinner with him at the evening. And I was super excited about that. And actually, he reached out to me as a very established researcher in the field to ask about my opinion of a potential clinical trial. And he asked me to collaborate with him, which was really overwhelming for me. And from this dinner together in Brussels, I developed my program of research together, being mentored by him partially. And yeah, this is how it develops.
Yeah, that's remarkable. It's amazing how one encounter can really change the trajectory, of your career. Can you tell us a little bit more about the value of mentorship and what that's meant to you as you progressed in your career?
Oh, absolutely. So during my time when I was in the phase of as an early career scientist, I always had great mentors. So with whom I was meeting, for example, twice during the week, or at least once during a week. And I had always good mentors to whom I could reach out, to whom I could send emails, and they were quite responsive. And it was always a gift for me that I had persons as well identified with whom I could collaborate and to whom I could send any questions. And they were all responsive, or I identified those or tried to intensify my work with those who were responsive, who helped me a lot. And I am really grateful for the different mentors which I had during my career. Yeah.
Yeah, no, that's wonderful. I certainly agree with all of those things. And I think that some of the best mentors are those who allow you to speak freely, ask questions, can provide guidance in a very sort of timely manner. Speaking of questions, can you talk to us a little bit about what sort of questions you're asking in your research career today?
So the overarching purpose of my research activities is to simply improve nutrition practice for our patients on the ICU. So especially here from the European perspective, I have recognized that nutrition practice is largely under-recognized on our ICUs. And we have still to work more on awareness, it is one quality indicator for good critical care medicine in Germany, but it is still under-recognized. So this is one of my major goals, to really contribute to the awareness of nutrition practice and to work on this to increase that. And the other is, together with my international colleagues, I'm really grateful to work on different clinical trials to evaluate the potential clinical significance of different micronutrients, vitamins, and other nutritional strategies like high protein to improve our patients' outcomes.
One of the hot areas right now is metabolic resuscitation, where as you know very well, using high doses of micronutrients to really affect the trajectory of how our critically ill patients will do. Can you talk to us a little bit about which specific micronutrients you're interested in, and where you think we're going with metabolic resuscitation.
So this is a really good question. So I'm passionate about vitamin C. So as vitamin C probably belongs to one of the most promising vitamins which we have right now in our nutritional toolbox. And beyond that, I'm interested in vitamin D as well. There exist different strategies. We have learned a lot during the past decade about vitamin D, where it works and where it maybe not works. And maybe this is a segue to the other point, the other aspect. So from the pathophysiology, we all know that we need vitamin C, we need vitamin D, we need selenium or other micronutrients, but it is a key aspect to identify those patients who are in need for specific therapies, therapeutical approaches, to identify patients, and on the other hand, to identify such patients who are maybe who not benefit from specific therapies like these. So we really have to focus on patients who are on who have a specific need for these micronutrients or vitamins here.
Yeah. No, that's excellent. One of the other questions that gets asked a lot in this forum is, what kind of advice or what would you say to somebody who is just starting off? And let me maybe preface by saying somebody might look at your career trajectory and say, wow, he's really reached, the top of the mountain, or he's getting close to the top of the mountain, but when you were maybe at the bottom of the mountain looking up, I imagine it was quite daunting, as it was for me, for example. What advice would you give to somebody who might be looking up at that mountain, and having trepidation about their career and where it's going? What kind of advice would you provide?
So maybe I'm not in the position to give already advices, because I'm not at I'm still within my career, so I'm just saying this humble. But one of the key factors of success was that I always had a great team, so with whom I could critically discuss research projects, research questions, clinical questions which I had. So I tried to reach out to different people, clinicians, attending physicians, consultants from different specialities. I tried to learn from them. I did not want to sell my opinion. I just wanted to listen to them, to collect different viewpoints. And with all of that, we, not I only, we as team try to identify a strategy to move on. And I was really grateful that always during the different phases of my career, I had great teams, great friends and colleagues who were all keen to develop the best way to move on. And I think this is really critical, that you have a team where you have the philosophy of radical candor, where you can critically discuss specific questions to move on together with one solution or one answer in the end. And I think this is really one key factor of success. And of course, try to reach out to people who are stakeholders in the field. If they not respond, try to reach out to others. And I think this is really very important, to talk with different people, get their opinion, collect perspectives. And I think this is really an asset for a successful career. And
Yeah, no, that's wonderful. I couldn't agree more. I think science is really a team sport, and it's, the beauty of what we do is that those individuals who start off as our colleagues, soon become, our friends that we can just, spitball with and run ideas by. And I couldn't agree more. Dr. Stoppe, thank you very much for that sage, advice. At this point, I would like to thank you, for joining us today. I would also like to thank ASPEN for their partnership for this forum. Thank you for joining us today. And depending on where you are, have a wonderful day or night.
Thank you so much. It was a pleasure. Thank you.